Thank you, and hello. My name is Raul Grijalva. I represent the Arizona's 3rd Congressional District, and I'm privileged to be chair of the House Committee on Natural Resources. I'm honored to be joined by my friend and colleague in Congress, uh, who has been a leader in the House of Representatives, Mr. Donald McEachin of Virginia. For those of you who haven't met him and know anything about him or heard him speak before, Mr. McEachin has been a strong leader on environmental and economic justice since before his time in Congress. And he's been a very powerful and advocate and partner in Washington. And I'm very grateful for his time today. In 2018, he and I launched the Environmental Justice Initiative to find ways to end environmental injustice and inequality in our country. Earlier this year, we joined together to introduce the Environmental Justice for All Act, and we're here today because of the serious structural problems that our bill is designed to solve, and those problems getting worse and becoming more glaring with this pandemic. I'm also happy to be joined today by our colleagues, the committee's vice chair, Representative Deb Haaland from New Mexico, and also chair of the subcommittee on public lands, by our friend and strong presence on our committee, the Resources Committee, Representative Alan Lowenthal from California, also chair of the subcommittee on mineral resources and energy, both of whom are original co-sponsors of the Environmental Justice Bill. We're going to talk a bit about today about our efforts to address environmental injustice and why tackling these challenges are so crucial for the health of our country going forward. We're here not just because of the coronavirus and it is hurting the people that we represent, but because some communities are feeling a lot more hurt than others. We're seeing the human cost of decades of economic and legal neglect in low-income communities, tribal communities, indigenous communities, and communities of color. It's time to talk about the ways we can end these injustices, save lives instead of sacrificing them. People exposed to high levels of pollution and toxic chemicals are at severe risk from the coronavirus. We know that means working class neighborhoods, that means Black and brown neighborhoods, that means poor neighborhoods, that means Native American communities with legacies of pollution and that the polluters never cleaned up. It means communities that get ignored and that too often powerful interests treat as expendable. Today, we're going to learn more about the unique experiences of environmental justice communities during this outbreak. Look at the economic and public health outcomes of decades of systemic injustice and explore what actions Congress must take to address these unique challenges. I happen to be sitting in my office in my neighborhood where I grew up and where I still live here in Tucson, Arizona. When the data came out in terms of zip codes, my zip code, which is working class, predominantly Latino, working poor, older people, ranked the highest in the state in terms of those that had been infected with the virus and the fatalities from the virus. And I mention that as a backdrop to what I think all of us are here to address, that those kinds of inequities have been constant, but there's a glaring light on them now. And there's a new portal that people, I hope, are looking through to see how we can change this dynamic that has been with us too long. I'd also, at this point, let me now offer our committee's vice chair, Representative Deb Haaland, to share a few remarks with us before we go on with the panel. And I want to thank the panelists for being with us. Uh, very appreciative that you're all here. And followed by, Ms. Haaland will be followed by Representative McEachin and then Representative Lowenthal. With that, Madam Vice Chair, the time is yours.
Thank you so much, Chairman. I am so grateful that you have put this roundtable together, and so honored to be joined by our esteemed colleagues and everyone whose charge is to make our country a better place in terms of our environment. I am the Congresswoman for New Mexico's 1st district. Albuquerque is the largest city in my district. But there are a lot of rural communities a few national parks or national space, open spaces in my district as well. But look, in New Mexico, Native Americans are about 11% of the population. Over 40%, 47% of the positive coronavirus cases. The legacy of uranium mining and respiratory illnesses attributable to methane leakage from oil and gas development and other pollutive environments leaves these people particularly vulnerable to coronavirus. Thousands of New Mexicans were downwind of nuclear weapons testing during the Manhattan Project and were exposed to radiation, but have never been given compensation or access to the health care they need to deal with health impacts. Their underlying health conditions make them more vulnerable to the coronavirus. In an effort to compensate the US government's theft of Native American land and the decimation of their cultures, the Indian Health Service was established to provide health care to Native Americans. However, a long-standing history of underfunding of the Indian Health Service has led to significant challenges in providing services and to substandard care and distrust of healthcare providers, exacerbating this coronavirus pandemic. These conditions are mirrored across the other environmental justice communities as we try to deal with this pandemic, and it's costing our people and their parents and grandparents their lives. I want to thank you all so much for your commitment to this cause, for sharing your thoughts with us on how we can ensure this doesn't happen in the future, how we can ensure that the work we're doing today will make a better environment for all of our people tomorrow. And I just am very grateful to all of you for the work that you do. So thank you so much, and appreciate your having this, Mr. Chairman.
Thank you, Deb, and thank you for the leadership that you've shown to not only the committee, but to the Congress in the short time that you've been with us. It's been a joy to get to know you. And to my chairman, Chairman Grijalva, thank you for all that you've done. And it's an honor to work alongside you to extend the promise of environmental justice for all, to all. I want to offer my deepest appreciation to our panelists. They are experts in their field, and we are deeply appreciative of them being with us today. You know, the issue of COVID-19 mixing with environmental injustice is a real one, and as the chairman said, it is the reason that we have assembled this panel today. It is of no little moment that we see this these two things coming together in such a tragic way. Since my time in Congress, Chairman Grijalva has been very kind and has sort of pulled me along and helped give me a national perspective on the environmental justice issue rather than just my parochial Virginia perspective. And through that national perspective, I have learned that we really need to give each environmental justice community its own seat at the table. Instead of trying to give answers from the top down, we need to give answers from the bottom up. Each community is unique. Each community knows what will work in its community, and it's our job to listen, which is why we have convened this panel. It is why we have done in our legislation an attempt to make sure that we hear from all by using the internet, by bringing the EJ community to the table to hear from them. We'll have more time to hear from me later on. I want to get to our panelists, but first I want to hand off to my dear colleague, Congressman Alan Lowenthal. Thank you for being with us.
Thank you. I hope everyone can hear me. Can you? Yes. Thank Grijalva, Vice Chair Haaland, my dear friend Representative Keith, for all continued work on this, their leadership on this issue. I also want to thank the important panelists that we have here today. It's a very, very diverse and good group of folks to educate us. I also want to thank all those who are tuning in now to to watch us. I hope you're continuing to remain safe, healthy, and that you're all practicing physical distancing, social distancing. While the COVID-19 crisis is front and center in all of our minds, what sadly is not as fully recognized is how disproportionately impacted frontline and fence line communities are. COVID-19 crisis has further brought to light the inequality in our system, with the coronavirus being twice as deadly to minority communities. Then to top it all off, in the middle of this health pandemic, this administration is rolling back environmental safeguards such as NEPA and lifting EPA monitoring and EPA oversight. This is going to negatively impact every American, but it's going to disproportionately impact environmental justice communities. My introduction to the environment was 28 years ago through environmental justice and public health issues around the ports of Los Angeles and Long Beach. First, I was a community activist, then a city councilman and a state legislator. We're going to hear later on from one of our panelists about some of the impacts around the port area. It's for that reason that I'm extremely proud to be joined today by Sylvia Betancourt and the rest of the panelists to highlight this critically important issue. I want to thank everyone for watching and being here. Thank you.
Introduce some of the panels, followed by Mr. Lowenthal, Representative Lowenthal, to also introduce some of the panelists, and then we'll begin their presentation. Mr. McEachin.
Thank you, Mr. Chairman. It's my pleasure to introduce a few of our panelists. The first one is a constituent and a dear friend, Dr. Reverend Henley. He is the pastor of Cedar Grove Baptist Church in Charles City County, Virginia, which, as I said, is located in my congressional district. Reverend Henley is an enthusiastic retreat, workshop, and conference speaker, facilitator, and teacher. And I can testify from having sat in his church, he's a fiery and inspirational preacher. For over the past 17 years, Reverend Henley has served as pastor and executive administrator of the Cedar Grove Baptist Church, where they have come to the realization that they are a people of God, chosen by God to be servants of God. Reverend Henley resides in South Richmond, along with his wife, Reverend Francine, and their daughter, Mariah. Mariah is a recent graduate of Virginia Union University, which is my alma mater for my Master's of Divinity. He also currently serves as the Band Boosters President for the Virginia Union University Ambassadors of Sound Marching Band. And then we also have with us Dr. Francesca Dominici, with Harvard University's T.H. Chan School of Public Health. The doctor is one of the authors of the recently published study entitled Exposure to Air Pollution and COVID-19, Mortality in the United States. It could not be a more timely publication than that one. The doctor is a professor of biostatistics at the Harvard T.H. Chan School of Public Health and co-director of the Data Service Initiative at Harvard University. We're also honored to have with us Michelle Roberts, the National Co-Coordinator with the Environmental Justice Health Alliance for Chemical Policy Reform. Ms. Roberts is a member of the Environmental Justice Working Group that the chairman and I have formed together. Excuse me. I promise you that's my allergies, not the virus. For many years, Ms. Roberts has provided technical assistance and advocacy support to communities on the impacts of toxins on human health and the environment. Ms. Roberts also has co-authored several important reports on environmental justice. And with that, I'll hand it off to Congressman Lowenthal.
Thank you. I'm pleased to introduce now Mr. Matthew Bruni. Matthew Bruni Project joins us today to discuss the connections between poverty, public, and unequal distribution of resources. Mr. Bruni is currently the president of the People's Policy Project. He previously worked as a lawyer at the National Labor Relations Board and as a policy analyst at Demos's think tank. Prior work primarily focused on inequality, poverty, and welfare systems. We also have from my community, Sylvia Betancourt, who is a program Long Beach Alliance for Children with Asthma, or as I like to call them, LABACA. She has had extensive experience in community outreach, engagement, and health, and in environmental justice, particularly in the context of freight transport industries. Sylvia is driven by her own experiences as a Mexican immigrant who has lived on the fence line of industry and who has been for justice and for healing. Sylvia serves on the Miller's Children and Women's Hospital Asthma Center of Excellence, their leadership team, on the University of Southern California's Environmental Health Center's Advisory Board, and the Long Beach Board of Health and Human Services. And finally, we're honored to have Dr. Cecilia Martinez, who is the co-founder and the executive director of the Center for Earth, Energy, and Democracy, and a co-author of the Equitable and Just National Climate Platform. Dr. Martinez projects at the local and at the international levels. Her research is focused on the development of energy and environmental strategies that promote equitable and sustainable policies. Dr. Martinez has served on the Climate Action Planning Steering Committee for the City of Minneapolis and has been appointed to several national advisory boards.
Alan and Don for the introductions of our esteemed panel. And let me begin immediately with the comments and perspectives that Reverend Henley brings to this discussion. Reverend, the floor is yours.
Good afternoon to everyone. First of all, I would like to thank my good friend, Reverend McEachin, Representative McEachin, along with Representative Lowenthal, Chairman Grijalva, and Vice Chairman Haaland, for taking the initiative in making sure that environmental justice communities have a voice. I'm reminded as I sit here of a quote that is attributed to the Reverend Dr. Martin Luther King Jr. that says, an individual has not started living until he can rise above the narrow confines of his individualistic concerns to the broader concerns of all humanity. That's why we are here, because we are concerned about what I like to call the greater good, and for us to gain a greater understanding of how we can impact this world in which we live in a positive way. Living by that mantra has contributed to the success of our ministry in Charles City County. For those of you who may not know, Charles City County is a beautiful rural county located between Richmond and Williamsburg and has a storied history. The population is predominantly African American and indigenous. For a long time, it has had very few economic resources and slow to no growth or services for residents. As a result, Charles City County is often targeted by large corporations for polluting projects, such as a current landfill emitting hazardous gases, enormous gas plants that people are selling their souls to get approved, and life-threatening pipelines that even the SEC is trying to help push through in the middle of a pandemic. From there, I'll say this. I've been serving in Charles City County for the better part of 17 years, and I've seen a lot of things. But COVID-19 has hit us hard. It has presented challenges that we've never seen before. The challenges that we have as a community have been magnified as a result of this novel coronavirus. The basic ability to communicate has been fractured all around. Churches are challenged to create alternative ways of keeping people engaged and empowered by the word of God through conference calls or parking lot services, because the lack of a countywide internet service makes screaming very difficult. Our seniors have a hard time with doctor's appointments because they're unable to access the telehealth portals. Our school-age children have struggled in the community because with schools closed, they aren't receiving the instruction that's needed to keep up with a changing world. They are not afforded the opportunity to keep up with their studies via the internet like neighboring localities. Their only option is for their parents to drive them to the high school parking lot, and they have to sit in their parents' car and use the school's hotspot to complete their coursework. They are not able to adequately access the materials that they need to stay on top of their grades to be successful. And even with that, all of that going on, county residents are being left out of the loop as the SCC plans on holding a hearing on a gas pipeline permit using Skype, knowing that the majority of the county will not be able to access the hearing. Again, I say we have been hit hard, but the Charles City community is resilient, and we will, with God's help, rise above all that is going on. Thank you.
Reverend, let me now turn to Dr. Domenici. The time is yours, Doctor.
Yes, hi, good afternoon, and thank you very much for the opportunity to address you all, and I'm delighted to be here. I wanted to talk about data and talk about science. I've been spending my entire career estimating health effects of air pollution. And let me start by making 2 points, even before of data and studies that we have published, even before the coronavirus pandemic. And then I'm going to turn to the most current studies. So first of all, I want to make sure you are all aware that Afro-American in this country systematically breathe a higher level of fine particulate matter than white Americans. Although the levels of air pollution in the last 20 years have been declining over time, the difference, the level, the fact that Afro-Americans breathe more polluted air are not changed. So even though we have been cleaning up the air, the environmental injustice remain systematic and has not been addressed. And that is a very, very clear data that I can provide you. Second of all, even before the coronavirus, I led the largest ever studies in the United States, looking at over 60 million of older Americans, over 96% of the US population, to look at the long-term effect of fine particulate matter on mortality, all-cause mortality. In that study, which was published in New England Journal of Medicine 3 years ago, we found that Afro-Americans experience a risk of death for any cause associated with long-term exposure to fine particulate matter that is 3 times higher than the rest of the nation. Again, 3 times higher. This was mentioned in many situations by Senator Cory Booker, to just, further, pointed out that Afro-American in the U.S. breathing higher level of pollution. Even though we're cleaning up the air, we are not cleaning up the air equally for everybody. And Afro-American have a higher risk of death for all-cause mortality associated with long-term exposure to fine particulate matter. Again, 3 times higher than the rest of the nation. So now, when the coronavirus started and the pandemic started, I immediately turned my attention to study the long-term effect of fine particulate matter and death rate for COVID-19. We were able to leverage the data, the science that we built over many years. And we included in our studies over 3,000 counties in the United States, again, over 90% of the US population. And what we did, we developed statistical modeling to estimate the relationship between historical exposure to fine particulate matter and the death rate for COVID-19. We conduct the analysis, we adjusted for population density, the time since the pandemic started, socioeconomic status, income, racial differences, age structure of the population. Well, we found that even a small unit change in historical exposure to fine particulate matter increased the risk of death for COVID-19 by 8 to 10%, which is a significant amount. Now, from a biological and clinical viewpoint, that makes sense because if you're living in a geographical area that has higher level of fine particulate matter, the small particles penetrate deep into your lungs. They can also get into your bloodstream, initiate a series of inflammation. And this is very well documented even before the coronavirus epidemic. So then, if you're getting the virus on top of that, your vulnerability to have worse symptoms increase tremendously. And so I think that if you're putting together the fact that Afro-Americans are historically breathing more polluted air, that Afro-Americans tend to be at a higher risk for mortality from fine particulate matter, and the fact that the exposure to fine particulate matter increases the risk of mortality from COVID-19, you could imagine that at this point, the air that we breathe and environmental factors could be one of the key factors that explain why we see a higher mortality rate for COVID-19 among Afro-Americans. So thank you for your attention. I'll be happy to address any other questions you might have.
Thank you very much. Let me now ask Ms. Michelle Roberts for her comments. The time is yours.
Hi, thank you, Chairman, and thank you, representatives, for providing us the opportunity to be part of this esteemed panel. My name is Michelle Roberts, the National Co-Coordinator with the Environmental Justice Health Alliance for Chemical Policy Reform, and that's a very long name by choice and by reason, with love and affection by the many affiliates that we serve in the Environmental Justice Health Alliance. These are legacy communities, if you will, that span our nation and are at the fence line at some of our nation's most egregious industrial operations. These are communities who you just heard Dr. Dominici speak to, and equally the communities that the Pastor Henley spoke about with respect to his community. These are the communities who, like my family, as I think about my uncle, David Roberts, who died at an early age of the TB epidemic, my grandmother, Pauline Dickerson, equally dying in situations of separate but unequal access to health facilities, if you were, back during the TB epidemic. And then let's fast forward into Katrina, where Katrina pulled back the covers on the racial disparities even more so. And let's not forget the environmental justice movement, who came by the thousands in 1991 with their voices to be heard, and continuing to author up various data sources, documents that show the disparity with the initial document, Toxic Waste and Race, and taking us into documents such as the Environmental Justice Health Alliance authored, that of Who's in Danger, Race, Poverty, Chemical Disaster, Life at the Fence Line, Watered Down Justice, Participating in the Equitable and Just Climate, but all to say that we have had a myriad of challenges, and equally that of data sources that we've been sharing that seem to fall on deaf ears until we have processes such as the process of that of the Environmental Justice for All Act, if you will, of the various members. And thank you, Chairman and Mr. McEachin, for bringing that process to bear, because it allows for community members to be able to bring their voices to bear and actually talk about the needs for having solutions that factor in that of cumulative impacts. And other things such as what we lifted up into this bill. And equally per se, as an organizer and a particular political challenging time such as now, what better time, and even though it's very dark, the light for us, Pastor, the light for us is the fact that for the past couple of years, these leaders on the Hill have at least been reaching to constituents across the nation, seeking to bring a more just union, if you will, of bringing everyday voices who are living in the shadows. So those folks that we all know, all of us friends here that know, have been impacted by the COVID. The good news for us is that we have moral and political will to move us beyond. And there's that little light, as my grandmother would say, in the shadow that moves us beyond the darkness. So we are very pleased and happy to be here with you all today, and to really dive down deep, understanding and knowing that this is not the beginning, but equally understanding that we also must talk about the fact that when we speak of EJ, it's from cradle to grave. So as we even discuss issues like having access to these tests, we must also equally understand that the waste from those tests will go somewhere. And where will that waste be transported and go to? And the fact that these tests must be secure and accurate, so therefore those in the 1% must receive the accuracy that those in the 99%, because we remember those days as well. We have a challenge before us, but the good news is we have people on the ground united together. And as you say, Chairman, with these portals that we have seeking to share our information, we are hoping that and looking forward to, under the leadership of you all, that we make sure that those most impacted with those tiny bits of light have the light to bring that full light for all of us to have wholeness and health for our communities. Thank you very much for being part of this process.
Thank you, Michelle, and thank you for your leadership throughout this whole process and the development of the legislation. Myself and Mr. McEachin are very appreciative of your advice and your counsel through this whole thing. Thank you. Let me now introduce and invite Byrne for his comments, sir.
Thank you. You know, in the sort of economic policy sphere where I tend to do most of my work, one of the things we like to do is figure out how things are being distributed in society. And that task tends to bias you towards things that are a little bit easier to measure. So we can count up how much income everyone has and figure out how that's distributed across society. We can do the same thing for wealth. We can do the same thing for college degrees. We can do the same thing for a lot of things that are very easy to count and that come to mind very easily. But in doing that, one of the things we miss is exposure to environmental toxins, proximity to landfills, these sorts of things. We don't draw charts of, the proximity to those kinds of things, but those things also have to be distributed in society, right? If you're going to have, as we have right now, 64 million housing units that have lead paint in them, well, who's going to live in those housing units? How are those housing units, or I guess, how are people going to be distributed into those housing units versus the housing units that don't have lead paint? Or if you're going to have 2,000 landfills, there's going to be a certain percentage of people who have to live near those landfills. And so how is that going to be distributed? And, I think that is a very, that is something that is missing, I think, from our inequality discussions. We talk a lot about the top 1% and wealth inequality and that sort of thing, but we don't talk about the top 1% of people who are exposed to pollution, or the median person who's exposed to pollution. And that is, I think, partially due to a lack of availability to some degree of statistics. The census doesn't put out a survey once a year that tells you exactly how much lead each person has ingested. But people are ingesting that. And I think that's something that this bill and other efforts, take seriously and need to take seriously. To give a few statistics, Black children are 3 times more likely than white children to have elevated blood lead levels. For particulate matter, we just went over that, of course, Black families are 50% more likely to live in the most polluted areas in terms of particulate matter than white families are. And so I think the distribution of those things, they exert a force that is not the same as income and has to be addressed differently than income. Though, of course, we have to recognize the correlation between the two, because who do we distribute next to landfills? Who do we distribute into unsafe housing units? We distribute poor people and people of color overwhelmingly and disproportionately. So, it all comes together, but they need to be addressed separately to some degree.
Thank you. Let me now ask Sylvia Betancourt for her comments. Thank you for being here. Appreciate it. All of us do.
Thank you for the opportunity to speak today and to share our story of what's happening on the West Coast in Southern California, particularly Los Angeles, and up from the coast into the Inland Valley region. I work at the Long Beach Alliance for Children with Asthma, and we're based at Miller Children's and Women's Hospital of Long Beach, which has a Joint Commission accredited for Pediatric Asthma Center of Excellence. LABACA, as we're affectionately known, has existed for 20 years. Congressman Lowenthal was one of our early supporters and allies, and we came together because a child died of asthma on the school campus. And while we know that asthma as an illness can be deadly, it's also preventable. It's preventable in that with education and also with reduced triggers for that which causes asthma in the first place. So when we look at our communities, we look at context and history and the immediate exposures to out in our communities. For LABACA, our goals are to keep children in school, to make sure that they're not falling behind, to make sure that their parents aren't missing work because of their child's asthma. We also want to make sure that children are not in the ER or in the hospital, but they come to us, to our program, once they have any of those criteria, when their asthma is essentially out of control. And so when we work with children, we know that social determinants of health are important at looking at how do you help a family to better manage their child's asthma by looking at what is around them. What are the competing priorities for many of these families that are vulnerable? In these vulnerable positions there, it's access to good living wage jobs that don't expose them on the front lines to polluting industries. Housing must be affordable for families. But in these homes, because housing costs are so high, we have multi-generational families and overcrowding. Also, our housing is oftentimes uninhabitable where there's mold, pests, lots of dust, the kinds of things that really should be addressed by property owners. Food access, access to nutritious food, transportation. Oftentimes a family member may have issues with simply being able to get to the doctor. Now that problem gets magnified when you have an asthma emergency and you don't have transportation. Healthcare access. What's important for our families is that we be sure that they have access to healthcare, adequate healthcare, and so that they're informed and able to make decisions, able to advocate for their children and for themselves with their doctors, at school, or even with decision makers who might be making a major decision about a project that's going to be sited near their home. When we think about where we live, what matters is what's around us. Our home can also make us sick. Our neighborhood can also make us sick. We think about the cumulative impacts. Those cumulative impacts we know that what matters is the numbers of polluting facilities matter. Proximity, as my colleagues have mentioned, matters. We know that fence-line communities are completely surrounded by industry and bisected by transportation corridors here in our region. We also know that time is another factor for environmental justice communities when we're thinking about cumulative impacts. Numbers of facilities, proximity, and time. How much time is spent where we live, where we work, where we play? Our communities are exposed over a longer period of time. And while there's a large body of evidence that shows that there are associations between higher levels of air pollution and health impacts, for our vulnerable populations, children whose lungs are still developing, who breathe faster than the rest of us, pregnant women whose fetuses are still developing, who are showing higher numbers of premature births and low birth weight babies, our elders whose bodies are starting to slow down and become much more vulnerable. All these populations within our communities that have been defined as environmental justice communities, communities of color, working class, working poor communities, oftentimes families whose English language is not your dominant language, who receive information in languages that are not understandable. Sometimes even if it's in English, it's not understandable. For our communities, what it looks like, if I were to paint a picture, because I've had the privilege of having worked in multiple communities from the coast here in Long Beach out to the Inland Valley region, what we see are communities that are part of a global system of freight infrastructure. We are neighbor to the combined port of LA and Long Beach, the largest and most active port complex in the country, that bisects our communities by transportation corridors, freeways, rail lines, intermodal facilities, mega warehouses that draw lots of trucks, many of which are sited right next to elementary schools, where trucks sit idling right in front of the school while they're queuing to go inside to the warehouse, and children are playing outside. We also find dotted along this corridor lots of other kinds of facilities: refineries, oil drilling, chemical and pesticide production facilities, lead smelters, incinerators. These facilities all have impacts to our communities, both acute and long-term kinds of health impacts. We know that from the USC, University of Southern California Children's Health Study, that found that children who grow up near diesel sources of pollution have higher rates of asthma, have a reduced lung function, and those children that are exposed to nitrogen dioxide, elemental carbon, these all come from vehicle emissions and fossil fuel combustion. We know that our children, who are among the most vulnerable population, have also more incidents of missed school days as a result. Now, We know that in this COVID-19 world, that this has drastically changed for our communities to be able to reach each other, to communicate with each other, to access healthcare. Even our own home visit program can't take place. That's where we provide our education. And now we're reaching out to families in different ways and having to address many of their needs, whether that be economic, social, mental health, and health as a result of their inability to access food, income. And so our priorities now are to reinforce education for our children, to keep them out of the ER and the hospital, because if they go to the hospital or the ER, they're going to be exposed to something far worse. Their parents will as well. And we also want to ensure that hospital resources aren't diverted to something else, when we know that right now hospital resources are precious.
Thank you very much. Let me now ask Cecilia Martinez for your comments. Cecilia.
Thank you, Chairman Grijalva, and thank you so much. It's an honor to be asked to be here with you all, with Representative McEachin. And I just want to also offer a really special and important gratitude towards Representative Haaland. You are quietly and forthrightly showing your leadership as a Native woman. And I know many of us as Indigenous people are really, really thankful that you're there, along with Representative Grijalva, McEachin, and Lowenthal. So thank you. The public health and economic crises caused by the COVID-19 pandemic underscores why justice and equity must be at the center of a bold agenda to confront the interrelated challenges of unequal access to essential resources, as well as the disproportionate toxic emissions exposure, climate change impacts, and economic inequality that have already been mentioned. Many of our communities are already battling the normal conditions of health impairing pollution that contributes to health disparities. The emergence of emergency events like COVID-19 only exacerbates this inequality, as we're all seeing. Providing for the most vulnerable should be our moral compass. And by doing so, we will also serve the needs of all members of our society by providing the resources and opportunities to uplift the well-being of all families and all children. The existence of health disparities across race, ethnicity, and socioeconomic conditions has been well documented for decades. Yet, we still continue to face the challenge to reduce these disparities. As noted by the National Conference of State Legislators, despite ongoing efforts to reduce health disparities in the US, racial and ethnic disparities in both health and healthcare persist. Even when income, health insurance, and access to healthcare are accounted for, disparities remain. In addition, over a decade ago, the World Health Organization's Commission on Social Determinants of Health called for worldwide action to address the social, economic, and environmental conditions that impact health, stating that social injustice is killing people on a grand scale. And we know this, as folks have already on this panel have already mentioned. In Native communities, Native people suffer disproportionately from hypertension, asthma, cancer, heart, and cardiovascular disease. That puts them at a higher risk of fatal complications from the coronavirus. American Indians are also 200 times more likely to die of diabetes than other groups, and more than a quarter under age 65 lack health insurance. In addition to this, the historical trauma that the coronavirus already imposes on Native communities because of past US policy, because of past efforts by the US government to assimilate and to destroy families, will also have an impact on Native communities. The Latino community, according to the U.S. Center for Disease Control and Prevention, show that over a third of Latinos live in counties that violate air quality standards. And while they may live as long than their white counterparts, the data also reveals that the quality of life is severely impaired by the variety of chronic conditions such as asthma. So it's clear that while this country's history of environmental regulation has produced significant benefits, there is critical and vast room for improvement. Not all communities have benefited equally from government actions. And it's for this reason that many of us, both grassroots organizations and environmental organizations, came together to produce the Equitable and Just Climate Platform. It is not only an agenda for climate change or for a national climate agenda, it's also an agenda for environmental justice. And I want to offer just a few of the items that we think are really important for Congress to move forward on to address both the disproportionate environmental inequalities as well as the coronavirus realities. First, a critical step forward will be to address the reality of cumulative impacts of the multi-risks of multi-source pollution, as well as the very real biological, social, economic, and climate change risks that plague our communities across the country. Further seeking further congressional actions, and we applaud the Environmental Justice Act for All. It is exactly legislation like that that we need in this country, in addition to addressing the inadequacies in the Clean Air Act and the Clean Water Act, other pieces of legislation like the Environmental Cleanup Infrastructure Act. All of these pieces of legislation really address the multi-source, multi-risk issues that plague our communities. In addition, we need to invest in air monitoring and community science. As we are seeing, EPA cannot be solely responsible for data collection, and our communities do need the investment around air monitoring community science. One of our sister organizations in Chicago, Little Village, right now is dealing with the devastating impacts of the destruction of a coal plant that they finally successfully shut down, and then was imploded right during Easter in the middle of this coronavirus, further exacerbating the air pollution and the coronavirus issues. We sincerely hope that there will be a pushing for an Office of Community Impacts within EPA at a high level. We hope that Congress can continue to advocate and support and secure an EPA budget that will be appropriate to the kind of implementation actions in accordance with the agency's mission to protect human health and the environment. Of course, our brothers and sisters in communities, both on Indian nations as well as in urban areas, where water infrastructure is sorely lacking. It is abhorrent that in the 21st century, the United States still does not have drinkable, potable water for many of our communities in this country, and that potable water has to be brought into these communities at a time when we are also experiencing a kind of pandemic of the strength and the character and the scope of COVID-19. And lastly, we would just like to ask that we continue to push that data collection, and particularly data collection on race and income, be a fundamental part of executive actions, and that we continue to ask and implement equity and justice metrics and targets for all types of legislation and agency action. In this way, we believe that no community will be left behind, and that is the environmental justice ethic, that no community will be left behind in any kind of situation, including this of the COVID-19. So this, of course, means health access and health services, including mental health services, but it also means us being proactive in a range of legislation that we've outlined in the platform. So thank you very much, and really appreciate this opportunity to speak to you all.
Thank you very much. Let me, thanks a lot to all the panelists, and the issue of cumulative effects, and we're dealing with them. I mean, the accumulation of history, the accumulation of discrimination, the accumulation of the people not having political power or being heard, and the poverty and the lack of access to basic services, i.e. health in this instance. Those have all been systemic and something that many of us, and certainly everybody in this forum, have been advocating against and wanting change for many years. And so I think the discussion today is not about us being alarmists. On the contrary, we're pointing out that as we are dealing with this pandemic, that at the same time, we have to come to the realization that anything we do, we're providing relief with the CARE Acts, although I don't believe they've gone far enough, and I don't believe that this administration can be trusted to implement it correctly. We're also talking about recovery, and we talked about that portal. So what is this recovery going to look like? Are we going to do status quo and communities still be left behind as we talk about the normal? I think that's the task in front of us, and the piece of legislation you referenced couldn't be more timely, my colleagues, because it sets a template about recovery needs to be more than putting all the little pieces back the way they were. That's not going to work. It's not going to work for the communities that we're talking about today. Let me turn to Ms. Haaland, if she's with us, for any questions she might have for the panelists, and then Mr. Lowenthal, and then Mr. McEachin, and then I have one question also, and then we can move her to close. But Ms. Haaland, if you have any questions.
Thank you, Chairman, and thank you all so much for being here, for giving us your where you are on this issue. It's been an issue for such a long time. I don't necessarily have any questions. I'm grateful that you are there working in your communities to make sure that you're fighting for the things that people need. Cecilia, I appreciated your comment on data collection, because that is absolutely important. We need to know, as I mentioned in my opening statement, New Mexico, 11% of the population for Native Americans, 47% of the positive cases. Data is one of our most important tools to fight anything, and certainly this pandemic. So I appreciate you mentioning that. I wish you wouldn't have told me you were in Taos, because that's one of my favorite places in this whole world. And I'd really love to be in Taos right now, but I'll save that for a later time. But all of your comments were extremely important and highlight the reasons why all of us, me and the chairman and Don and Alan, why we all work so hard to make sure that folks are in an even playing field. It's time for us to stop polluting the communities who are most vulnerable, and that's really what it's been. Right now, fighting this pandemic on the Navajo Nation, we know that a lot of folks don't have running water, but there's people who have running water and their water's polluted because of mining. So yes, it's a respiratory illness, but the ways in which we have left vulnerable communities behind, communities of color behind for so long, everything's exposed right now. So I appreciate all of you and all of the good, solid information that you gave us today, and I'll yield back. Thank you, Chairman.
Thank you. Mr. Lowenthal, any questions?
Yeah, I have a few questions. My first question is for Dr. Domenici. Your research was fascinating listening to you, but what follow-up research would be helpful to build upon the findings that you've reported to us? And what role can the federal government, how can we more adequately fund and support these kinds of research needs?
Right. Thank you. Thank you for the question. So I think that a couple of things. I think what would be most helpful are, going back to what we've been saying, two things, data and money. So the most important thing is data, because right now what's happening is that the study I conducted because the Johns Hopkins Tracking Center allows to access real-time data on number of deaths for COVID. But this is the total number cumulative for the county. So I don't have the number of deaths broken down by racial groups, minority, or age groups. And this data is there. It's just that the Department of Public Health do not release to us. So that's one thing that can be really helpful is in the context of COVID outcomes, the number of hospitalization and number of deaths, to make the data available to scientists, broken down by both racial subgroups and age groups. And right now there are really no limits about confidentiality. We can do our research maintaining the confidentiality. So that's really important. The second is, and I'm very open about, is funding for research, and especially the research at the intersection of environmental justice and COVID. The EPA does not have a research funding for now many years. As we all know, the research arm of the EPA has been completely cut. So there are really no research funding to do this, both data collection and both for the science. And so my study, although I appreciate your interest and you find it fascinating, but it's severely limited because I could not have access to outcomes for COVID divided by racial subgroups.
And I have another question for Ms. Betancourt. Wondering, you're on the ground, and so I'm wondering what your allies on the ground would describe as their top challenges in their response to the COVID virus, to the coronavirus, and how are the families in your community coping with this crisis? And maybe what are some of the long-term, it's a multiple parts of this, what are some of the long-term policy priorities that LABACA is advocating to increase their quality of life of their community?
Mm-hmm. Thank you for that question, Congressman Lowenthal. In talking with our allies and just taking an assessment of where we are, we were hit very hard, very squarely once the closures happened, once we started to see that the spread of this virus was impacting us globally and very directly right here in our own city in Long Beach. The primary ways that people are feeling this is in terms of housing, your income loss. Many families have lost income in this period, and many of our families don't have access to government kinds of programs because of their documentation status. Their ability to pay the rent is a huge impact. And so many of our partners are also working on tenants' rights and ensuring that our families would have a home to be safe in. For us, in our work in doing home visits, that's what we do. Our program is about visiting families in their homes and doing a home environmental assessment, assessing for asthma triggers in your home and in your surrounding community. We can go to anybody's home, and family members are being forced to be in their homes when their homes themselves are also making them sick. And they're being told to make sure that they're cleaning. And so people are using toxic cleaning supplies that are triggers for asthma, that are triggers for many other kinds of respiratory illnesses. And so we want to be sure that we're getting education out to our families so that they know that while they're safer at home, that there are certain things that they can do that are alternatives to toxic cleaning in their home. we're also, as a response, working with our partners to make sure that we get food delivered to those that are in vulnerable positions, those that have already underlying health conditions. We're also providing information across our organizations about where to get food, what places deliver food if that's something that is needed. In terms of our, and I should also add what is a huge priority is knowing that legislators here in the state of California have written to the California Air Resources Board requesting that any regulations around air quality be put on hold until at least 2021. For us was alarming. And so knowing that what we need in this response and ultimately a recovery, that we cannot recover and go back to business as usual. We have to recover and go back to work in a way that is just for everyone, that ensures that we have clean air in our communities, that ensures that we have stronger regulations and that the existing air regulations are enforced. We also want to be sure that our community members are the ones who receive funds directly and receive it first. We want to be sure that there is a just transition so that community members have jobs as they return to work and that these jobs are sustainable and healthy jobs over the long term. I think I'll stop there. Thank you for asking that question.
Great answer. Thank you.
Mr. McEachin, your questions or comments?
Thank you, Mr. Chairman. To Reverend Henley, I guess this is really a two-part question. First part is, do you feel our community was adequately prepared for the impacts we faced over the last several months? And is there more that the federal government could be doing to better inform and engage with community stakeholders such as yourself as the pandemic response and recovery move forward? And what do you think those actions would look like?
Thank you, Congressman, for the questions. Appreciate this opportunity. Do I feel the community was adequately prepared? I would have to say no. It wasn't prepared for the shutdown and wasn't prepared for life as we're living it right now. For instance, the community likes a grocery store, which creates food insecurities. I will say that a food pantry has been organized during the COVID-19 pandemic, so that is a positive. But right now, residents have had to travel to Food Lion in neighboring New Kent County or in Quinton to buy groceries. And if you don't have a car, you have to wait till you can find a ride to get there. Churches have stepped up. Cedar Grove, for instance, partnered with Concerned Citizens of Charles City County, C5, and the Charles City Ruritan Club, and we gave out free groceries, 100 bags of free groceries on Easter. Also, we've offered to put gas in people's cars, supply members with toilet paper and paper towels. And other churches have stepped up to help their members also. So the need is great. We're trying to meet the need. Also, people have been laid off, and the unemployment process, the federal government and the state, I believe, could have done a better job in communicating and working together to streamline the process for people applying for unemployment. I've heard horror stories, and even today, people still haven't received anything, and they've gotten frustrated by the process. And so every time I'm on the phone with my members, especially on the conference call, I share with them, if you do not understand, don't let the process frustrate you. Let me know, and I'll do whatever research I need to do to help you to get what you need. Is there more that the federal government could do to engage stakeholders? I would say one of the biggest things about Charles City County is the churches and getting the information out. The churches are the informational highway. And so with the internet, even if you have a hotspot, is very spotty in Charles City County. So in order to get information out, I would say maybe advertise on the radio, maybe have little spots on television, like during campaign season when you have the little spots or advertisements, or even have mailings that go to the churches. If you can't send them to all the individual houses, but that will get the information out, get the information in the hands of the people, and they will be able to know what they can do to take care of themselves and get what the government is trying to help with the process.
Well, thank you, Reverend. And let me just say, particularly with regards to unemployment and my constituents, your parishioners, if our office can help, don't hesitate to call on us.
That you do, and you've been very helpful. You take care of your community, and we really appreciate that.
Thank you. I yield back, Mr. Chairman.
Thank you. Let me, just a general question for any of the panelists that wish to try to respond to it. In this real time that we're in right now, there's all of the discussion seems to be centered around when do we open up again? When do we return to normal, whatever normal can be defined as? And you have all these machinations that are going on at the federal level from this administration who have, we don't need to repeat how they have aggravated the situation of this pandemic more than it should have been. You end the testing that is not occurring. Arizona has got the lowest per capita testing rate in the country. And in a rush to get 60,000 tests done, they picked locations over the next few weekends. And the first ones that were picked were inaccessible to the communities that we're talking about, for them to get there and to get those free tests done. Another example of what we've been talking about. My point today is, let's talk about the reopening and why, and the communities that we've been talking about today, how that fits in, both the preparedness and the concept of what do these communities need in order to say, you're open, not only open for business, but open for the social life that was once part of those communities. Any panelist can speak to that. Anybody?
I would definitely say more testing. There has to be more testing.
Thank you.
Mhm. And this is Cecilia Martinez. I would say, obviously, and first and foremost, we need to use the best science and the best evidence we have before us. The fact that we are not using the best science to actually direct how and when we reopen is abominable in this day and age. And I think, I think all the communities that we're talking about, they are first and foremost concerned about their families. They're concerned about their children. They're concerned about their elders. Those are the critical issues. And until the federal government can ensure that both they are getting the kinds of treatments and the health services they need, that the science and the best knowledge that they have is that it's safe for them to reopen, I think we have a critical gap. As well as the stimulus packages move forward, it's absolutely, and I think everybody has already talked about this, but we need to target those economic development, those unemployment, the kind of resources to sustain our families during this time of crisis. They need to be prioritized to the most vulnerable. And then I think our communities will feel a lot safer.
I agree with Cecilia on all the points that were I agree with Cecilia on Dr. Martinez on all the points that were raised, and equally with respect to the right to recover and return. I think it is important that we really make sure that the social conditions are really deeply addressed in a fundamental way. As you heard Dr. Martinez said, especially with these stimulus packages that are coming down. This could either exacerbate the social conditions, or it could at least address begin a process for addressing. In addition to that, let us not forget that the US EPA has suspended the enforcement process. So all of these things will put greater burdens on states, as already has, and all states are not created equal. They don't respond in equitable and just ways, let alone being able to articulate the words. So there has to be some type of fundamental process to address legacy harm and challenges, and equally making sure, again, we can't say it enough, that these stimulus packages are literally getting to those who really need to be served. And this hardcore last, when we think about reopening, we cannot think about reopening to the business of yesterday's business. We have to really think about reopening to that of making people whole. And we have to really think about defining what makes people whole. And the only way you can find that out is to hear from the people themselves. Thank you very much for this opportunity.
One thing I would add is,
That's okay.
yeah, real quickly, it's important to point out that in reopening the economy, it's not enough to just sort of get rid of restrictions on certain businesses operating. You're going to have to actually convince people that it's safe, because if they're not convinced it's safe, they're not going to go to the shops, the restaurants, live entertainment, the sort of things that are closed down right now. They're just not going to go. They're going to stay in their home because they're going to be scared. So I think this has been one of the mistakes in the discussions on this so far in the states, is the governors will say, oh, well, we'll just sort of push a button and reopen. But if 30-40% of people still stay home, the businesses are still going to fail because they're not going to get enough customers in the door. So getting people convinced that it's safe, which probably means making it actually safe at minimum, that's going to be necessary before reopening can possibly work. Even passing laws is not going to make unless you're going to force people to the stores, it's not going to achieve what you're trying to achieve.
So a quick thought is that I'm sure that you all are aware that the current Trump administration is rolling back and try to roll back all of the major environmental regulations, including try to stop the revisions of the National Ambient Air Quality Standard. And so as we are reopening the economy, as considering all of what we have been saying, and the importance of looking at data and evidence and science, not to impose even stricter regulations than what we had before, to me, it's really irresponsible. And we know that the community that would be more affected would be the most vulnerable one. So I think that my recommendation would be to really go full force and make sure that the environmental regulations are indeed implemented based on the best possible science. We're saying that we need stricter national ambient air quality standards for fine particulate matter, and to fight as much as we can these attempts to roll back the environmental regulations, because we know who's going to be the people that will pay the hard consequences.
Thank you very much. Adam, how much time is left on this for this forum? Are you available?
We have 5 minutes left.
Yeah, let me ask my colleagues if they would some brief closing comments, and Mr. McEachin.
Mr. Chairman, I just want to thank you. Mr. Chairman, I just want to thank you for your leadership and your advocacy and your patience with relatively new members like myself. This is my 3rd year in the Congress. I want to thank our panelists for their time and their expertise and their passionate advocacy on behalf of EJ communities across our country. I believe that how we handle this pandemic will shape our society for decades to come, and we have to ensure that the needs of EJ communities, from funding critical programs to reducing pollution that will make it harder for communities to recover from the pandemic, are addressed in our response. I'm committed to being your partner during this pandemic and the recovery that follows and beyond. Thank you so much for having me today. Thank you for participation, and God bless you.
Thank you. Mr. Lowenthal.
Well, thank you. I've learned so much. Every time you listen to the people, you listen to, we learn as policymakers. I want to say one quick story. Over 20 years ago, I was walking to tell people I was running for city council, and I'd knock on everybody's door and I'd say why I was running, and people would say, well, that's really interesting, Alan. But tell me, what's this black soot that's in the window? Why are my kids missing school so much? What are you going to do about it? And I said, well, I have the same black soot in my window. And I said, if I'm elected, we're going to form a group and we're going to learn everything about it and understand why we're able to fix this problem. And I learned right after I was elected, fortunately, for me anyway, I don't know about my community, but I was elected. And I began to learn that there really rarely had been any cumulative data to understand where was this black soot coming from. We would do project by project, but we didn't have the data to understand it. And when I went to talk to people, I found there were other people for years had been raising these issues, but nobody was listening to those folks. And so then I went to the ports and I said, you've got to fix things. And they said, well, that's not our job. We are in the economic development. We need to be the largest in the world, and we'll mitigate some of those problems later on. But it was finding groups like LABACA. It was finding the parents of kids that had asthma who would come with me, and I would literally drag them to the city council to testify about what were these impacts and what were they doing. And over the years, because of community groups like LABACA, because of people rising up, this economic model changed. We don't have to have a fight between economic development and public health and environmental protection, especially in those communities where there's the most impact in terms of environmental justice. We can rethink what our values are and what our models are, and they have done that. They have really worked really hard to reduce the pollution as the highest priority in the ports. And you know what? They're still making a lot of money by doing that. This does not have to be an economic loss to anybody. By changing the environment, protecting the most vulnerable can be a gain for the people who are the most vulnerable and also for our economy in general. And the other thing I've learned, I want to say, is we're not in this for the short haul. It is not just about where we are today and whether we're going to open up the economy and that's the end of it. We are in this for the long haul. We have got to recommit ourselves that everybody has to have the opportunity of clean air, health, and well-being. And that's who we are as Americans. And that's what this pandemic has demonstrated. It's not over because we open up things. It's a recommitment to really making this a safer, healthier country.
Okay. Ms. Haaland?
Thank you all so much again for being here. Our doors are open to you. Please stay in touch with us. Let us know how we can help and what we can do to magnify your voice on these important issues. I was thinking as Mr. Lowenthal was talking, him and Chairman Grijalva came to New Mexico, and we had a field trip and a field hearing, and we talked. It lasted for 3 days. We met with environmental justice stakeholders at a roundtable one evening, and then we visited some gas and oil sites, looked through an infrared camera and saw methane spewing out from pipes. This is all in the northwest area of New Mexico. The methane cloud above New Mexico, you can see it from space. That's how large it is. And the gas and oil industry have a responsibility to clean up after themselves. because this is impacting our children's futures. And so, so we remain committed to pushing these issues forward. And, you know, I have been advocating for the environment for all of my organizing career, and I've been doing it for a long time. You know, sometimes when you're an organizer, you feel like your work isn't being heard because just as Ellen said, you're knocking on doors, you're talking to people. So I can't tell you how grateful I am to be a member of Congress right now with my colleagues to push on these issues because that's what we need to do to make the change that we need in our country to protect our kids from pollution, because they deserve to grow up in an environment that is alive and that is healthy. And so I'm just very proud to stand with my colleagues pushing those issues forward, and of all the legislation that they've sponsored and co-sponsored, and all of us working together. And we can't do it without you. So thank you for being here.
Thank you, Deb, and thank the panelists. I just want to close by saying I appreciate very much everyone here and my colleagues for their strength to this issue. You know, we're dealing with an administration that sees public health as, if that, as a secondary issue, if that, and I doubt that it's a secondary issue to this administration. They see support for the industry as the primary issue, how profits are turned, and in doing so, eliminating the essential protections and emphasis that should be in place to protect people. So we know what we're up against, and many times I sense that they view the communities that we spoke about today as collateral damage in terms of support for the industry. And our work is to change that. Our work is to make sure that as we define the recovery and the new normal, that the things that have the cumulative negative effects upon our community are not part of that recovery definition. We have work to do. The new support packages that are coming out have to include the beginnings of addressing the issues that we talked about today. So thank you so much. Appreciate you all being here, and those of you that were part of this by listening in and watching us. Thank you very much, colleagues and panelists. Have a good one. Be safe.